Multiple sclerosis and you. Dysphagia is one of the early signs of MS. SwallowSafe.com/education is an ASHA-approved CEU provider, and we have courses that cover a wide range of topics. These courses are available to anyone, but also provide clinicians with the continuing education credits they need for relicensure. We get questions about some of the terms and topics in those courses, so at Science in a Sec, we're here to give you a little more information. Today, I'm going to give you an overview of key concepts in multiple sclerosis, signs, symptoms, and how it can relate to your life. We begin with the story of Andy Kopsa, whose life changed at the age of 35 while on a normal morning commute. Suddenly, her rib cage began to tighten painfully, and a wave of numbness and pins and needles washed over her. She later described the sensation as if someone were wrapping her entire body in tight, heavy bandages, squeezing the air out of her. Terrified, she sought medical help immediately, but doctors were initially baffled, checking her for everything from meningitis to rare tropical fevers. Eventually, she landed in the ER and then to a neurologist. Even then, diagnosing MS took time because doctors usually need evidence of at least 2 separate neurological attacks. It wasn't until the second flare-up hit that summer, backed by a battery of MRIs and spinal taps, that she finally had a name for her condition. This is an all too common situation. The symptoms of MS can be scary and erratic, making it hard to diagnose and can often take months or even years to narrow it down. Roughly 1 million Americans live with the disorder every day, and the clinical world has made an advancement in managing the condition. Although researchers aren't sure why, MS is 3 times more common in women. Age is also a critical variable. For instance, moving to a new climate before age 15 can actually shift your lifelong risk. Ultimately, MS is the result of a genetic loaded gun being fired by environmental bullets, like viruses and low vitamin D, during a specific window of development. We're going to talk about MS and then focus on how MS causes dysphagia, because roughly 40 to 55% of MS patients have swallowing problems. We're going to give you some insight into what dysphagia instrumentation and treatments are available. We encourage you to connect with us on our social media and the SwallowSafe.com website to see how you can take control of your situation today. Let's get started. What is multiple sclerosis? MS is a condition where your immune system, which is built to protect you, actually turns on you, attacking the protective coating on your nerve fibers called myelin. Think of it like the insulation on an electrical wire being stripped away. When that coating is compromised, the electrical signals traveling between your brain and your body get interrupted, delayed, or cut off entirely. Because your central nervous system controls every movement and sensation, the early signs of MS can be unpredictable. For many, the first breakdown happens in the eyes, appearing as blurred vision or dull colors. Others experience sensations such as persistent pins and needles or the MS hug, a strange sensation of an invisible band squeezing the chest. A classic red flag is there meets sign, a literal electrical shock feeling that zips down the spine whenever you tilt your chin towards your chest. As the damage progresses, coordinating the body is unreliable. You might trip over your own feet, feel sudden muscle weakness, or deal with vertigo, which has that spinning sensation of being on a merry-go-round. Even the muscles used for speaking and swallowing can be affected, making basic communication feel like a chore. Perhaps the most draining aspect of MS is the invisible symptoms. It isn't just common fatigue. It is a profound, heavy exhaustion that turns limbs into lead and creates a brain fog that makes concentrating nearly impossible. These symptoms often flare up when the body overheats. Because these issues mimic so many other conditions, doctors must use MRI scans to hunt for the telltale scars or lesions left behind on the nerves to confirm the diagnosis. Like most neurological disorders, MS has a genetic factor. Some people carry risk genes, such as the HLA variant, which acts like a faulty security system. These genes provide the instructions for your immune cells, and when these instructions are coded incorrectly, your immune cells mistake your own nerves for the enemy. MS is tripped by environmental factors. Genes are not the whole story. You usually need an environmental factor that triggers MS. A primary cause is the Epstein-Barr virus. Through a process called molecular mimicry, your immune system fights the virus but becomes confused. It begins attacking the myelin because that coating looks chemically similar to the virus itself. Other sparks include your geography and lifestyle. People in colder, less sunny climates have higher MS rates, largely because vitamin D keeps the immune system from becoming hyperactive. Factors like smoking, childhood obesity, and the balance of your gut bacteria can also push the body into a pro-inflammatory state, making an autoimmune attack more likely. MS affects the CNS, but not the PNS. The signs and symptoms of MS are determined by the location of the inflammatory lesions and subsequent demyelination within the CNS only. The peripheral nervous system, known as the PNS, is not affected because the CNS and PNS have different types of immune mechanisms, though they serve the same function. Plaques or sclerosis accumulate in the brain, brainstem, or cerebellum, which produce the distinct MS neurological deficits. We cover the CNS versus the PNS, sensation and motor actions, neurotransmitters, and the structure of neurons in other Science in a Sec articles. These can be really helpful for you to find out more and give you a background that will help in understanding MS. We're going to give you a small overview here. MS and the cortex. The cerebral cortex of your brain handles thinking, feeling, and processing. When MS targets this area, it often leads to cognitive changes. This is what we mean when we say MS can cause brain fog, where your memory feels fuzzy or your brain just processes information more slowly. Because this area also manages our emotions too, it's very common to experience mood and emotional disturbances like depression or anxiety. Another major player here is fatigue. It isn't just being tired after a long day, but a deep, crushing exhaustion. Over time, chronic inflammation can lead to brain atrophy, which is a scientific way of saying the brain loses a bit of its volume as tissue is damaged. MS, the brainstem, and the cerebellum. Think of your brainstem and cerebellum as the ultimate coordination team for your body's daily operations. The brainstem acts as a high-traffic bridge where every signal between your brain and body must cross. Because it is so densely packed with vital wires, even a tiny MS lesion can cause a massive ripple effect. This often disrupts your fundamental functions, leading to diplopia, double vision, nystagmus, jerky eye movements, or vertigo. It also houses the central pattern generator for dysphagia, which means if this area is out of sync, the complex muscle coordination needed for safe swallowing or clear speech, which can be dysarthria, can be disrupted. Meanwhile, the cerebellum refines your physical movements, making sure they are smooth and precise. When MS affects this region, actions become ataxic or clumsy, often resulting in hand tremors when reaching for objects, or a shaky gait that makes walking in a straight line a challenge. Together, These two areas manage the rhythm of your life, from the fine motor skills in your fingers to the seamless timing required to swallow your food without a second thought. MS and the cranial nerves. When MS creates lesions in the brainstem, it essentially interferes with the connections between your brain to your face and senses. While any of the 12 cranial nerves can be affected, a few specific ones tend to show up most often as clinical red flags. I have trouble seeing sometimes, or I go blind. The most frequent sign is optic neuritis, which involves the optic nerve or cranial nerve 2. While the third cranial nerve, the ocular motor nerve, handles the movements of the eye, cranial nerve 2 controls vision itself. Deficits in cranial nerve 2 usually show up as vision loss in just one eye. Doctors look for a relatively afferent pupillary defect, also known as Marcus-Gunn pupil, where the pupil fails to constrict properly when light is shown into it. Patients might also notice central scotomas, which are essentially blind spots right in the middle of their field of vision. My eyes just don't seem to work together. MS also disrupts how the eyes move together through a couple of cranial nerves. We already mentioned the ocular motor nerve, but there are also the trochlear and abducens nerves. We won't go into what each nerve does, but together, your eyes, eyelids, and areas around your eyes can move so you see not only in front of you, but all around you. A classic hallmark of MS breakdown in eye movement is internuclear ophthalmoplegia. This happens because of a lesion in a specific pathway called the medial longitudinal fasciculus. When this pathway is damaged, one eye struggles to move inward toward the nose, while the other eye drifts outward with nystagmus. This lack of coordination leads to diplopia. I get weird sensations. I can't really move my face, and I get vertigo. MS also affects sensation, being able to express thoughts and emotion in the face, and overall balance. For example, the trigeminal nerve, which is cranial nerve 5, is responsible for facial sensation. When MS affects this nerve, it can cause trigeminal neuralgia, which feels like sudden, agonizing bursts of electrical shock pain in the face. In younger patients, this is a major diagnostic clue. A major cranial nerve is the facial nerve, known as cranial nerve 7. As you might guess, it controls a big portion of the face, especially the cheeks and moving your mouth to make a sound or to eat. Facial nerve breakdown can lead to facial myokemia. Unlike a nervous tic, this is a continuous involuntary rippling or quivering of the facial muscles that look like tiny worms moving under the skin. When MS patients have vertigo or balance issues, this involves the vestibulocochlear nerve, known as cranial nerve 8. These symptoms aren't just a brief dizzy spell. It is a persistent sense of spinning and equilibrium issues. It is often paired with a version of nystagmus that doesn't go away, or fatigue with rest, which helps doctors distinguish it from more common inner ear problems. MS and the spinal cord. When MS moves into the spinal cord, it causes myelitis, which is inflammation that disrupts the pathways connecting your brain to your body. In MS, these lesions are usually partial, meaning they only affect specific lanes of traffic rather than the entire width of the cord. Most of this activity happens in the cervical spine of the neck. We go over what total and partial paralysis, especially in the cervical spinal region, is in Science in a Sec, What are motor disorders? I talk about my own journey with cervical spinal partial paralysis, and we mention MS. Checking it out could give you some great information that takes this topic even deeper. The sensory highways. The spinal cord houses the dorsal columns and the spinal thalamic tracts, which handle your sense of touch and position. When these are damaged, an MS patient might experience an electrical shock that zings down the spine when they tilt their chin to their chest. Because the nerve breaks down in the myelin, simply moving the neck triggers a false electrical signal. Movement and muscle control. The cortical spinal tracts are the motor lanes that carry go signals to your muscles. Because MS damages the CNS, MS is considered an upper motor neuron disorder. This isn't just simple weakness. It often involves spasticity or stiffness, hyperreflexia or overactive reflexes, and the Babinski sign, where the big toe fans up instead of curling down when the foot is stroked. An MS patient might also notice paresis, or a feeling of heavy legs that often shows up as the foot drops, making it harder to clear the ground while walking. The automatic systems. Finally, the spinal cord manages the autonomic pathways that control things we don't think about, like the bathroom and intimacy. A neurogenic bladder happens when the connection between the brainstem and the lower spine is frayed. This can lead to detrusor sphincter dyssynergy, which is a fancy way of saying the bladder tries to empty while the sphincter stays locked shut, causing urgency and frequency. The path to an MS diagnosis. Since no single test can definitively identify MS, clinicians have to put on their investigator caps and, through a process of exclusion, rule out other lookalike conditions. Following the McDonald criteria, they must prove MS occurred in at least 2 different locations and at separate points in time. While an MRI is the primary tool for spotting the telltale white plaques and lesions that signify nerve damage, doctors often use a single scan to establish where the deterioration is. They look for both old scars and active inflammation simultaneously, giving them what they need to diagnose MS. To solidify a diagnosis, supplementary tests help clear away diagnostic static. This involves a lumbar puncture that may be performed to check the spinal fluid for oligoclonal bands, which are proteins indicating chronic inflammation. They could also perform an EEG, where they look for evoked potentials to measure the speed of nerve signals to detect hidden delays. Additionally, an optical coherence tomography scan can reveal thinning of the optic nerve, often an early red flag. This rigorous investigation is essential for distinguishing MS from other similar conditions, such as NMOSD or MOGAD, which are ruled out through specific antibody blood tests. By further eliminating one-time events like ADEM or genetic disorders like leukodystrophies, doctors can confidently confirm MS and begin targeted treatment. Kids get MS too, but it's a different beast. When MS strikes in childhood, it behaves differently than it does in adults, acting like a tornado hitting a house that is still being built. Because a child's brain is in a state of rapid development, the initial symptoms are often widespread, like blurry vision, shaky hands, and balance issues occurring simultaneously, rather than the single numb spot an adult might first report. Internally, a child's immune system is far more aggressive. An MRI of a pediatric patient typically reveals a higher volume of inflammatory scars compared to an adult, leading to more frequent relapses. However, young brains possess a remarkable ability to rewire connections and a high capacity for remyelination, which is the body's way of patching up the damaged insulation around the nerves. This allows children to bounce back from individual attacks with incredible speed, often returning to 100% function, while adults may struggle with lingering symptoms. The trade-off for this resilience is the timing. Because the static of MS occurs during critical years of growth, it can cause a brain fog that disrupts learning and memory. While the disease almost always starts as relapsing remitting MS, the clock starts much earlier. This creates a medical paradox. Children are significantly better at short-term healing, yet because they live with the condition for decades longer, they may face physical challenges at a younger chronological age than those diagnosed later in life. MS affects speech and swallowing function. We've talked a little bit about how the CNS breaks down in MS and how this can impact both speech function and swallowing. The truth is, MS wreaks havoc on how someone talks. We call this scanning speech because the natural rhythm of the sentence gets broken into choppy, individual pieces. Imagine a drummer losing their beat. The tongue and lips become weak and heavy, making words sound slurred or thick, as if you've had a few too many drinks. Because the CNS is struggling to coordinate every single movement, a patient might pause in a strange place or break words into odd syllables. Even the roof of the mouth can lose its grip, letting air leak out of the nose and giving the voice a distinct nasal quality. Swallowing might seem simple, but it is actually a high-speed, perfectly choreographed dance between your CNS and your muscles. MS disrupts the vital signals needed to perform the eat and drink dance safely. When these signals fail, it can lead to dysphagia, the medical term for swallowing difficulty. So let's take another look at those CNS structures, but this time we will focus on how deterioration in those areas affect swallowing function. The brainstem is key to the swallow. At the base of your brain sits the medulla, which acts like an air traffic control tower for your body. Inside, two command centers manage every bite. The first is the nucleus tractus solitarius, your input center. It waits for the sensation of food hitting the back of your throat. If an MS lesion blocks this center, the start signal is delayed. Food can sit in your throat before your CNS even realizes it's there, which significantly increases the risk of choking. The second center is the nucleus ambiguus, the output center. This is the engine room that tells your throat muscles to squeeze. When MS disrupts this area, the muscles lose their power. This results in poor pharyngeal constriction, which is the squeeze that pushes the food down, or weak laryngeal elevation, which is the way your voice box lifts to seal off your airway. MS dysphagia and your cranial nerves. The cranial nerves exit the brainstem and are essential to swallowing function. 3 specific nerves are often hit hard by MS. The glossopharyngeal nerve, which is cranial nerve 9. This nerve handles sensation. If damaged, you lose sensory awareness, and food can silently slip into your throat before you're ready. The vagus nerve, cranial nerve 10. This controls movement. Damage here often leads to vocal fold paresis, which is weakness in the voice box, resulting in a raspy voice and a weak throat squeeze that leaves the food behind. The hypoglossal nerve, cranial nerve 12. It's the tongue commander. While MS rarely causes the tongue to waste away, it often makes it weak, making it hard to form food into a neat ball or bolus to push it back. So far, we've covered most of the cranial nerves. Later on, we'll be releasing a Science in a Sec article specifically addressing cranial nerve function, so be on the lookout for that. Cranial nerve damage, either sensory or motor, on instrumentation like fees, are some of the most striking signs of dysphagia. MS fatigue is like draining the battery. For many with MS, fatigue of the swallowing muscles is like a battery that drains too quickly. It can turn a quick snack into an hour-long struggle. When this happens, a patient might notice a wet voice or coughing. Key warning signs that tired muscles are failing to protect the airway, leading to aspiration. Aspiration is when food, liquid, and or saliva fall into the airway, somewhere it should never be. A speech-language pathologist, the central clinician involved in treating dysphagia, may suggest eating 5 or 6 small, high-energy snacks instead of 3 heavy meals. They may also use thickeners that will slow down the movement of the food and liquids, giving your throat an extra split second to close the airway. The SLP, physician, nursing staff, and caregiver are all essential to helping an MS patient find their way to a safe swallowing experience. MS and the path to safety. A really dangerous situation occurs when food, liquid, and or saliva goes down into the airway, but the body does not sense that anything is there. This is called silent aspiration. It's tricky because the person doesn't even cough to signal something is wrong. To get a clear look at what's happening behind the scenes, therapists use instrumentation, such as video fluoroscopy, which is essentially a real-time X-ray movie of your swallow, or FEES, where a tiny flexible camera is passed through the nose to watch the throat in action. These tools allow dysphagia experts to grade the swallow and see exactly how much help the body needs. For more information on dysphagia and instrumentation, go to the swallowsafe.com website. We provide details on what instrumentation involves, along with a comprehensive dysphagia evaluation. Both instrumentation and a comprehensive dysphagia evaluation are critical to getting the MS patient on the path to safety. Once the team understands the problem, they might utilize one or more paths to get things back on track, such as retraining, where you perform specific exercises to strengthen the muscles used for swallowing. Rheology, where the care team changes the texture of food and drinks to make them easier and safer to move. Neuromodulation, which uses gentle electrical pulses to help the brain rewire and improve the signals it sends to the throat. If these steps aren't quite enough to keep the lungs clear, a PEG tube might be used. This is a small tube that delivers nutrition directly to the stomach, ensuring the body stays fueled and hydrated. By using these high-tech tools and tailored strategies, the care team can adapt to the MS patient's specific needs and get them on the path to a safe swallowing experience. Join us on social media, YouTube, and Spotify. SwallowSafe.com uses several social media platforms: Facebook, Instagram, TikTok, X, Blue Sky, LinkedIn, YouTube, and Spotify. We give you many different paths to a safe swallow, including articles giving you lots of information, kitchen table-like podcast discussions, a library of helpful videos, yummy dysphagia-safe recipes, and connections to dysphagia experts. One of the easiest and swallow-safe recipes is our delicious applesauce. One of my favorites is the turkey dip spread that you can put on anything or even eat all by itself. We put out seasonal feasts every quarter and a special one for different holidays. Our YouTube channel and social media have short videos where we make these recipes. More recipes are coming out all the time, and we enjoy these ourselves. I've talked about my own battles with dysphagia both here and in other places, and I can attest to how great these recipes are. When I'm tired or I'm just not swallowing quite right, they are essential not only for my nutrition, but to just having an easy, happy meal. For the MS patient and their caregivers, we strive to connect in a way that easily fits in with their situations. Like, follow, share, subscribe, and don't forget to comment below and let us know your situation and what information you'd like to see in future Science in a Sec articles and podcasts. Thank you for spending this time with me today. If you are a clinician and are looking for CEUs, we have neurology and other courses on swallowsafe.com/education.